The title of this conference is Transform, because at the Center for Innovation, it has been our bent that incremental change is insufficient and that transformation is really necessary. So I'd like to share with you a few thoughts that I hope you might then take back. The debate yesterday, I thought, was in a way interesting and in a way disappointing. It was interesting that we had great energy. It was disappointing that in the end, the two sides came closer and closer together and there was more agreement than there was debate. Over the course of this conference, we've heard some very important observations that I want to highlight and hopefully string together for you to go home with a better framework of how it is that we can go from a system of authority to one of understanding. Andy Slavitt started by saying that the debate in Washington about financing was really the irrelevant debate. The most important debate was about what we were going to do here in Rochester, Minnesota at Transform, to think about how we would create a better delivery system. In fact, we would say, how is it that you create health for people? And I would say that the current delivery system is not at all geared to deliver health. He also said that we need to find a way that will meet the needs of 70% of the population. And I can say from my experience in the Center for Innovation that people want health. And if we can find a way to make that work within a delivery system and a payment system that is easy and painless and less expensive. So as Peter Bach mentioned, the large majority of people who are finding a way to pay for those simple expenses in a membership model, we could find a way to do that in a much more affordable fashion. Now, it also means that we should, as people who understand healthcare, be more demanding. We should hold ourselves to a higher level of performance. So if we know, for example, that Cologuard is just as effective as colonoscopy in screening for colon cancer, why would we accept exposing people to the potential risks of colonoscopy when we could offer Cologuard? We could go back. We could change the order sets at our institutions so that the primary reason to get colonoscopy is that there is a positive Cologuard. We could go back and tell our companies, make as a benefit for us, if this is truly preventive, as the Affordable Care Act would define it, then pay for Cologuard for us without an out-of-pocket expense and make the out-of-pocket expense higher for colonoscopy, or change the way that we pay the providers. If we believe that we should be able to produce health, let's follow the advice of Elizabeth Teisberg, who said that in the value equation, let us put the outcome that makes the most difference to people. So for people with diabetes in the Center for Innovation, we have learned it's not glycemic control that makes a difference. It's not blood pressure control that makes a difference. It is how we are able to let people live their lives. I've said it at this conference before. The best definition of health that I ever heard came from a woman in Austin, Minnesota that we were following. She had diabetes. She was a mom. She worked. Her definition of health was, I can do everything I need to do so that the people who depend on me will be okay. Now, we know what that is, the WHO definition. That's the WHO definition. Not in medical speak, but in people speak. So we have to go away from here with a deep understanding of what people need. If we are continuing to pay for drug pumps and for medicines for diabetes, but we don't pay for a prevention program that we know that works, it is our problem. We should go back and insist that our companies, in their benefit design, give us that benefit. And that they work with other insurers and that they work with state regulators to find a way to make that happen. If it means that we would tax device companies to pay for the costs of that program, then maybe we should. Most of us yesterday declared at least some interest in doing sustaining innovation, not transformative innovation, when we voted at the end of the debate. So what I've just talked to you about is sustaining innovation. There's nothing there that's transformative. We know the answers. But then the next thing for us to do is to think about how we might transform the experience of health. And I think you're going to hear a little bit more about that this morning because it really means creating a movement, an expectation. You might call it a revolution, but at its heart, it is a movement, and we can lead that. 100 years ago, Dr. Will Mayo told graduates of the Rush Medical College in Chicago that they needed to go out in their communities and lead an effort to create health, public health. But that was before the era of antibiotics. It was in the era of difficulty with maintaining a safe water supply and food supply. The same challenge is in front of us, but we have better tools and we have better ways to think about it. But it really comes back to how we think about it. And so Catherine actually had a great statement. It's time for us to stop micromanaging and think about macro learning. So if I leave you with nothing else today, please leave with greater energy and greater devotion and greater dedication to becoming a macro leader. Thank you for being part of the Transform family. Without you, our work would not grow. Without you, our work would not be energized. And I hope that this group will go home and find people of like mind and energy who will then be able to be part of a greater movement toward health. It has long been our desire at the Center for Innovation to create a new experience of health that starts fundamentally from a deep understanding of what people want, and then to create the solutions that will meet that need, and then to find a way to make those solutions more effective and more efficient. But more important, to use that knowledge to create adaptations in the system that will make it better and make it truly a system for health and not a system for health care, or more accurately, in my view, a system for sickness care. Our colleagues in the Center for Innovation are thrilled that you've chosen to spend a few days in Rochester. I hope that this Transform, the 10th, by the way, kind of an interesting anniversary for you, for us, has been one that you will look back on with some satisfaction, that we've been able to test your way of thinking a bit and create some energy to go out and do this work of creating health. Thanks again, ladies and gentlemen. It's been a privilege for us to host you.
Thanks so much. So we have a few minutes to talk before our panel comes on now. What would your most important message be to the folks who attended the conference? You talked about changing the focus of this conference from previous transforms.
So for us, it's about, again, understanding what people need and then finding ways that we can make that happen. I think we saw yesterday that you can do that in lots of ways. There's not one way. But we just need to be able to see it and do it.
So how does this relate to what's going on in Washington?
The debate in Washington is all about financing. There would be no debate in Washington if we actually were able to create a system of health, because it would truly reduce the costs of care. And we would have more than enough money to find a way to expand Medicaid and to make sure that Medicare beneficiaries have a better benefit. So in reality, the challenge is for us in healthcare.
And can you talk about, and we asked some of the panelists yesterday, but you are obviously the best example of this. Can you talk about the experience of doing innovation? I think a lot of people in the audience are interested in this, or transformation within an institution, and that is very much, an established medical institution. The challenges of teaching old dogs new tricks, even if they're fabulous old dogs.
large institutions like Mayo create a substantial inertia of structure. But there are always people within this organization who are energetic and willing to try to do something different. They're great partners. And being able to work with them and then tell a story of success is actually what helps us advance innovation more than anything else.
Great. And what about, what do you think this hospital will look like in 10 years, or all of these big hospitals in 10 years? What's your dream? Where would our healthcare be?
My dream actually is that there aren't any more buildings in Rochester, Minnesota devoted to hospital care.
And where would that be?
Well, the dream is that we would care for people at home with better technologies and treatments and greater confidence. We know now we can treat many people at home, but we treat them in hospitals. There's not a reason for us to continue with that kind of problem.
I mean, you're a cardiologist by training,
Yes.
and you still practice. I mean, that's one of the most procedure-intensive, I mean, the magnificent advances in the procedures, in the drugs. What do you want added on to that?
Consider atrial fibrillation, a significant healthcare problem for the United States. We'll spend tens of thousands of dollars to think about ablation or to think about more expensive medicines. But the reality is that for a person with atrial fibrillation who is overweight and out of shape, getting to a normal body weight and achieving cardiovascular fitness will reduce their risk of recurrent atrial fibrillation by more than 90%. Wow. Better than any drug and better than the catheter ablations that we do.
Wow.
So it's time for me to be a reformed cardiologist.
Well, it seems like you're here, you're doing this. When did you kind of say in your career, because I think a number of doctors are in this position now where they've been doing what they've doing, they've become, as we've heard from various panelists, increasingly, kind of feeling like this system isn't working for their patients, and move to a new way of thinking. How did that happen with you?
So for me, it happened when I was vice chair of medicine with Dr. Nick LaRusso. The two of us started thinking about how we could do things differently. And Nick, who was a laboratory scientist, said we should have a laboratory. And I'm more of a clinician. So then we said, well, how about a laboratory that we could do clinical science in? So we created a program that we called the program in innovative healthcare delivery, but we didn't really know exactly how it would work.
See, I guess the first step is making that label. So now it's filling the void that's created under the label.
That's a lesson I hope everybody will understand. The first step is to declare a purpose.
Yeah.
And the second step is to be oriented toward action. And then you can make progress. And so that's where the transformation came for me.